Each year we strive to provide the very best care for our patients.
Looking to continuously make improvements
by investing in our hospital and community services.
This document sets out the Trust's operational plan for 2019-20. It builds upon the achievements and positive progress made during 2018/19 and recognises the key challenges facing the Trust and sets out our priorities for the year ahead.
Hello, my name is Osman Chauhan. I'm the Chief Pharmacist here at Rotherham NHS Foundation Trust. Welcome to the Pharmacy Department. We've been very successful this year in getting £750,000 worth of money from NHS Improvement to implement e-prescribing and medicines administration, EPMA. This will help us to deliver safe prescribing and safe administration of medicines for our patients. It also means that we will be able to communicate medicines-related information better to our GP colleagues and colleagues in the community. Another thing we've done really well in the course of 2018-19 is the use of biosimilar adalimumab. We managed to save several hundreds of thousands of pounds as a result of using the biosimilar, and as a result of that we are 100% using the biosimilar, and we are highest in the region, Yorkshire and Humber region, for that. It means that this trust can then reinvest that money in different ways for better patient care in other areas.
I'm Ellie, I'm the ward manager on B5, the non-elective surgical ward, and I'm really proud of my team for all that they've achieved in the last 3 months since we've moved due to the reconfiguration within surgery. One of the main challenges that we've had is the fact that we've had to learn to care for a completely different type of patient, having moved from urology to general surgery patients. So we're working with the pain team, stoma team, dietitians, occupational therapy, physio teams, to ensure that all that training comes to fruition to benefit the patients.
My area that I work on is looking at trying to reduce the inequalities in the difficulty we have with dental disease across Rotherham. One of the main areas is introducing brushing clubs, and these brushing clubs are all evidence-based, and what it means is that children across Rotherham, particularly in foundation stage, early year settings, all brush their teeth at least once a day whilst they're in setting. The children absolutely love it, they can't wait, they actually ask to brush their teeth, and parents have said that it makes it a lot easier. The biggie is to kind of reduce the number of anaesthetics that we have. That is quite a meaty target. And sugar's a major issue that we have, and the snacking and the continual grazing, and it all has an impact not just on obviously weight and diabetes and heart disease and cancers, but oral health wise.
Hello, my name is Jenny Swift and I am the coordinator of the new 0 to 19 weight management service. So we've had a really busy past 6 to 8 months. We've been a really ambitious team and we put together a service specification for a children's weight management service. And it's exciting because we've been successful and we've been commissioned to develop and deliver this service over the next 2 years. We highlighted that Rotherham were well above the national averages for childhood obesity and wanted to put together a unique package of care. We're in a unique position. We're working really closely with dietitians, CAMs, paediatricians, GPs. So we're health experts, we're working with health, but we're also integrated and working with partnership agencies. We're embedded in the community. So we're working with Early Help, Rotherham United Community Sports Trust, People for Places, other leisure services and other organisations. So we are really offering a unique package of care for children. It's a fantastic opportunity and I know we can do this because we've got great leadership, great team behind us, so yeah.
My name's Sarah Briggs. I'm a heart failure specialist nurse in the community in Rotherham, and one of the innovations that I've been involved in is delivering IV, so that's intravenous furosemide, for patients who would normally go into hospital. So these patients have heart failure. The enemy of heart failure is fluid retention, and that has historically meant the patient needs to go into hospital. However, we've located these, which are novel pumps, not needing electricity, and it means that we avoid hospital admission and the patient is where they want to be. Now, what we're able to do is deliver this to our patients, but only this is a drop in the ocean. So we have thousands of patients with heart failure in Rotherham. So if we had a dedicated intravenous furosemide service for our patients with heart failure in Rotherham, that would mean that we would save numerous hospital admissions and mean that patients with heart failure can be managed at home.
My name's Amanda Clark, and I am the joint head of the Care and Audiology service. We are an integrated service. We integrated several years ago, and we are a very close-knit, innovative team. And recently I've just won a Nursing Times Award for the care of the elder person, which showed that our service is integrated really well. We changed our service to provide a better patient pathway, quicker patient pathway for our patients. And recently we were very proud when our audiologist Christopher Hammond-Race was voted by the Rotherham Parent Carers Forum and was awarded a trophy for You Believe in Me, which showed how he helped children with special needs that also have hearing problems.
Hi, my name's Hayley Lee. I'm a midwife here at Rotherham. I work on labour ward and both at Warncliffe. I've recently been involved with the new balloon inductions. We're offering an outpatient service for our ladies who are being induced. Most of these ladies can go home with one of these in situ. So with the inductions before, ladies would come in and they would be admitted to the ward and they would stay on the ward. Where now we're able to offer that service where they can go home and stay at home in their own environment for 24 hours.
Name's Lisa Green. I'm an healthcare support worker on ASU, what's just opened. It's the old SAU, but we're up on B5. It's a lot better because we don't have as many admissions as we used to before. If they can sit in the sitting area, they'll sit in the sitting area and be assessed that way, so which frees the beds. Do you know, like, so they're not tied at a bed. And they can, if they go home and they come home back for scans the next day, it's just a bit more flexible than what it was before, and we're not tying beds up at all.
So how did it used to be?
When they come from A&E, they went straight into a bed, and they stayed there for days sometimes, do you know, like before, no beds about, so they stayed there for days. Now it's like they can go home and come back. Plus we've teamed up with B5 and Sitwell as well. So, do you know, like Sitwell, they have like appendix in, out, do you know, like, so it's fast turnover there. A little bit slower on B5, but do you know, like, we're a bigger team, do you know, like, and it works, I think it works a lot better.
My name's Andrew Jackson. I look after the vascular access team here at Rotherham. In particular, we've looked at clinical aspects of care. For example, we've continued to maintain our almost zero level of central line infection rates. In turn, we've focused on the community IV programme where we've saved thousands and thousands of bed days or inpatient bed days for the organisation. A particular highlight of the last 12 months is our trainee associate practitioner programme, where we've looked at developing new roles and new clinical skills for staff, taking away that glass ceiling that existed in the past, and now 4 staff are currently undertaking that programme, with another 2 just about to come online.
I'm Shri, I'm clinical lead for nutrition and dietetics. I'd like to tell you about our enteral tube feeding service, which was handed over by the endoscopy service in January 2018.
Since taking over the service, the dietitians have prevented over 50 hospital admissions, which is equated to 450 bed days. We've also reduced a number of district nurse and GP visits.
A survey we conducted showed that patient satisfaction has improved by 30% since taking over the service.
Since setting up parenteral and enteral nutrition MDT, we achieved almost 50% reduction in inappropriate referrals for parenteral nutrition.
My name is Binu Varghese and I'm the Specialist Registrar for Gastroenterology Department working in Rotherham Hospital. We've been working very closely and collaboratively with the Dietetics Department, and it has definitely improved our patient experience and outcomes. We have reduced the hospital stay and it has identified nutritional related issues, and we have actioned it very promptly.
The advancements that we have made within Rotherham have actually benefited patients whilst also cutting the costs to patient care within the Trust. This going forward is a very good, beneficial service which is fast acting and good for patient care.
And at the end of it, it's all about a person in a bed. It's about a patient, isn't it? So that's the end goal, is making sure that that person in that bed has the optimal management and care. Love. It's about love, isn't it?